Good afternoon, everybody. Welcome, welcome. Thank you for coming along to our webinar today. We'll just get people into the virtual room and then we will get going. Thank you for taking the time out to come and spend the next hour with us. And hopefully you're expecting to be at a joint Care Provider Alliance and Care Quality Commission webinar, which is focused on giving an update on the Oliver McGowan Code of Practice. So I'm going to do a few introductions because I have a number of esteemed colleagues here helping us with this session today. And then I'm just going to do a little bit of etiquette and ground rules for all of our attendees so that we can get the most out of this webinar, because I know you will have lots of questions and we want to make sure that we can answer as many of those once we've heard from our presenters. So my name's Liz Jones. I'm the Policy Director at the National Care Forum. We're a membership organisation for not-for-profit providers of care and support services, and we're part of the Care Provider Alliance. So let me ask my colleagues from other organisations within the Alliance to introduce themselves, and then we'll say hello to our CQC colleagues as well. So if I could go to you, Sam, do you want to introduce yourself?
Thank you. Hi, I'm Sam Leonard. I'm Director of England for the Association of Real Change. We're a membership organisation supporting providers who provide support for people with learning disabilities and autism, and I'm also part of the Care and Support Alliance.
Thank you, Sam. And just to say, I'm seeing some comments in the Q&A to say people haven't got sound, so I'm just going to ask my tech colleagues to just see if they can sort out some of our attendees' problems. Okay, thank you, Sam. Paul.
Yeah, hi there. I'm Paul Cooper. I'm a Senior Quality and Compliance and Innovation Specialist at the Home Care Association. So we are a professional body for home carers in the UK, and we're also part of the CPA. So thanks, Liz.
Thank you, Paul. And Finn.
Hi folks, Finn Tennerberry. I work at the National Care Forum with Liz in the policy team, and I look at learning disability and autism and workforce, many other great things. So it's great to be here.
Thank you, Finn. And Finn and Paul are going to help us keep an eye on the Q&A. So once I've introduced once I've asked our CQC colleagues to introduce themselves, I'll just run through a few of the ground rules for how to get the most out of the webinar. So Marie, would you like to say hello?
Thanks, Liz. Afternoon, everybody. My name's Marie Cox. I'm a Senior Specialist at the Care Quality Commission in the team for people with a learning disability and autistic people.
Thank you, Marie. And Caroline.
Hi everyone, afternoon. I'm Caroline Mulhall, and I am also a Senior Specialist in the Care Quality Commission in the Autistic People and People with a Learning Disability team.
Brilliant. And we're very grateful to our colleagues from the CQC for being up for this webinar. It's taken a little bit of time to organise, and so we know it's a very busy time for CQC colleagues, so thank you. So I'm just going to remind everybody what the webinar is covering, but also what it's not covering. So when we were talking to our CQC colleagues earlier in the summer, when the code was first laid before Parliament, we thought it would be helpful to organise a webinar to use the official commencement of the code to make sure that the care and support sector, the adult social care and support sector, had more insights into how the CQC is planning to regulate in relation to the code. What we wanted to try and preempt a number of queries that we were expecting from providers in terms of the approach to how the commencement of the code might make a difference or not. And so that is the focus of today's session. This session is not and does not have speakers from the Department of Health and Social Care or NHS England present to be able to answer some of the very burning queries that many of our members have had, specifically around access to funding for training to support staff to comply with the requirements of the code. So this is not the webinar that's going to talk about training and money. We will of course touch on that because those things are relevant, but we are not, this webinar is not designed to answer all of those questions. You will be glad to know that in the slide deck that the CQC are using, there are some links in the final slide to some FAQs that have been produced by Skills for Care, and you will also be delighted to know that there is planned a webinar specifically being run by DHSC in partnership with Skills for Care, which is on the 13th of November. So that will be the place to get some of those answers, no doubt. You will, as attendees who've registered for this webinar, you will have been sent an FAQ document that has been designed specifically for this audience for this webinar. So it's not for wider sharing because the CQC will have a whole load of information on their website that will respond to a number of your queries, no doubt, but it was specifically pre-reading to support you to get the most out of this webinar. There is a Q&A function, so you should be able to see a Q&A bubble or two bubbles on your screen. On my screen, they're at the top of the, they're on the top ribbon, and please do put your questions into the Q&A function. And do note that the webinar is being recorded. The slide deck will also be shared. So the webinar recording and the slide deck and a Word version of the slide deck, which I'm told is will be better for certain accessibility purposes. They will all be put onto the CPA website, so you will be able to see them afterwards and share them with colleagues. I think that's it in terms of etiquette and facilities available during the webinar. And as I say, Finn and Paul will be keeping an eye on the Q&A. So we'll have probably about half an hour from our colleagues at the CQC, and then we'll spend the remainder of the time looking at the questions that you put in the Q&A, and also asking any other questions that occur to us as presenters, because we can claim that privilege, I think. So I'm going to stop talking now and hand over to Marie and Caroline. Thank you all very much for coming along, and let's hear what we've got to say.
Thank you, Liz. Thank you. And thank you, everybody, for joining. I think it's important to start by saying that we absolutely recognise that, you know, we really all just want the same thing, and that is to make sure that wherever people draw on services, they do so and receive them in a way which supports them to have positive outcomes and equitable experiences. As providers, you will all want to deliver services that comply with regulations, and as CQC, of course, we want to see that. when you registered, you've been able to access the FAQ document, as Liz just mentioned, as a pre-read. We did that for two reasons, really. Firstly, because it's helpful to have it as a takeaway, but also so we can make use of the time that we have, and best use of the time we have today, by starting hopefully with a shared understanding of some of the broader points about the regulation. We don't have huge amounts of time, so we've tried to include in today's slide information that is hopefully the most useful to you. And whilst we obviously want to talk about the code of practice and what that means, how we'll use it and how we envisage you will use it also, it would be remiss of us not to just have a bit of a recap about our approach to the regulation more broadly. So without further ado, I'll hand over to Caroline to take us through the first half of the slides, and then I'll pick up later and speak some more when Caroline gets to the end of her bit. Thanks, Caroline.
Brilliant. Thanks, Marie. Okay, so first of all, we're just going to touch on what the regulation actually says and kind of who it applies to. So since July 2022, all health and social care providers registered with CQC have been required to provide training to staff in learning disability and autism. And that includes how to interact appropriately with autistic people and with people with a learning disability. And the training should be provided at a level that's appropriate to people's role. So it applies to all services and all settings, so not just specialist services for autistic people and people with a learning disability, and not just places where people live. So it applies to general hospitals and dementia care homes, for example. It also applies to all health and care staff, so ancillary staff, anybody that might have contact with a person with a learning disability or an autistic person. And it's really for providers to decide what training meets the regulation and what training they want to procure and use. And they need to be able to demonstrate, or you need to be able to demonstrate to CQC how the chosen approach meets those requirements. So as a provider, you need to assure yourselves that you're able to demonstrate your staff are trained and they're skilled and they're able to meet those specific needs of autistic people and people with a learning disability. So there's lots of information on our website, first of all, under the provider guidance section, and that was all updated on the 8th of September. So it's all up to date and it's relevant. And there's also links on this slide that will take you to the Health and Social Care Act, specifically where the requirement is cited, and we'll circulate the slides afterwards, so you'll have access to that information. So from a CQC stance, Regulation 18, which is the CQC regulation for staffing, has always required providers to ensure that staff are appropriately trained. But the change in the Health and Social Care Act specifically requires you to make sure that there's training relating to autistic people and people with a learning disability. So the requirements around Regulation 18, staffing are still there, they're still required. It's about that additional requirement around having appropriate training, support, professional development, supervision and appraisal, so that staff can carry out their duties and support autistic people and people with a learning disability. The statutory guidance on Regulation 18 was updated in July 2022. So the regulation's there, and there's an update to it that was put in place a few years ago. And there's two specific points that have been updated. So the first one is around ensuring that all staff receive training in how to interact appropriately with people with a learning disability and autistic people, again, at a level that is appropriate to their role. And the second part is around staff receiving appropriate supervision in their role. And that's to make sure that they're able to demonstrate and maintain competence, and they're actually able to put that training into practice and demonstrate that they understand the needs of autistic people and people with a learning disability, particularly in the service that they're working in with the people they're supporting. So as providers, it's being aware that, you know, when you're reviewing things like your induction, your training, your supervision plans, you're considering that update to the regulation. Again, you know, this is about anybody using services. So autistic people and people with a learning disability will access all regulated health and social care services, and they may accompany other people to do so as well. And that's why it's so important that that training is given to all staff. Again, I suppose the requirement means that more staff are going to need to be trained or have some form of training. So it's about, as providers, deciding how you're going to meet that, how you're going to consider what level of training people need for different roles and make sure that nobody's left out of that training. You know, you might have administration staff, or you might have domestic staff that need some awareness training, or might have occasional contact with people, in comparison to having, you know, healthcare professionals, support workers that have regular interactions with people that you feel need a higher level of training. So it's about deciding on what level of training staff need. It's also important to consider some of your staff may already have been trained. So you may have already trained staff, and it's about now checking that that training is still suitable, it still meets the code, and that you're able to monitor how effective the training is. Ultimately, you know, training staff and making sure that training is useful will improve people's experiences, and it'll improve outcomes for people who are using your services. So the next part is about CQC's approach. So as part of our assessments, we will look at whether staff are competent to support people. So we'll look at whether they're competent to support autistic people and people with a learning disability in that service. And the level of support differs depending on what type of service you offer. Obviously, it's important to recognise that everybody, you know, will offer access services differently, and you will offer different levels of support to people. And it's looking at individual need, and that's what we're going to be looking at. We don't prescribe specific training packages or methods of training. It's your responsibility as a provider to ensure that staff are trained in a way that meets the legal requirement and the needs of people. And that gives you the flexibility to tailor that training to the service that you're providing and to the roles of the staff. But it also means you have to be proactive, and you have to think about how you're going to approach it, how you're going to source it, and then how you're going to monitor it to make sure that that training is effective. It's really important as well to review relevant guidance. So the Regulation 18 guidance, and consider the specific needs of people. So, you know, once you've looked at that and you've considered what it says, it's about then deciding on what training is appropriate, how you're going to deliver it. And again, you know, that might range from basic awareness training to a more in-depth training, depending on the people you're supporting and the needs of people in the service. So the difference between the regulation and the code of practice. So the regulations set out legal standards that registered people must meet. So registered persons are registered providers and registered managers. And the regulations detail what they must meet and must deliver in line with the health and social care services. The regulations are mandatory requirements under the Health and Social Care Act, and providers and managers are responsible for the compliance. So, for example, Section 20, 5ZA of the Health and Social Care Act 2008 now requires staff to receive training on learning disability and autism appropriate to their role. Whereas the Code of Practice is something that has been issued by the Secretary of State under Section 21A of the Health and Social Care Act. The code acts as an official piece of guidance to support understanding and to support implementation of the regulation, but it's not a regulation in of itself. So the Code of Practice will help yourselves as providers and us as CQC to have a shared understanding of what compliance needs to look like. So the code is not enforced directly, but CQC will use the code to assess whether providers are meeting the relevant regulation. So that's the difference between the Code of Practice and what the regulation is. Okay, so compliance, non-compliance and proportionality. So all registered providers need to ensure that staff are receiving training that's appropriate to their role to comply with the law. You need to choose a training package, and it must meet the standards in the code, and that's what we will look at and what we'll consider. If there are concerns, CQC may use enforcement powers or take other actions if registered providers aren't meeting legal requirements. CQC will always take into account the Code of Practice and consider to what extent a registered provider is or isn't complying with it. So, for example, if staff aren't trained or a provider isn't following the Code of Practice, The onus is on the provider then to be able to demonstrate what mitigation's in place and what the action plan is. So if you've got a number of staff that aren't trained, what are you doing about that? How are you ensuring that staff are undertaking the role that's expected of them, and that you've got ways to monitor staff practice? So CQC will consider that, and whether providers are being proactive, and what the risks are for people if the code isn't being followed. So are there concerns about inappropriate care and treatment, or are there some mitigations in place to support staff to undertake their role? CQC obviously have civil enforcement powers, so if there are concerns about poor care or about people's needs not being met, then it may be that civil enforcement action would be considered. And I think it's just really important to kind of just say as well that we have to bear in mind that, you know, the reason why this training is so important is because not every person, particularly older people, not everyone has an autism diagnosis. So where there's autistic people who have maybe aged and not had a diagnosis, they may be living in your services or accessing your services, and you may not know about that. So it's really important to have that awareness, to think about, you know, how we support people, and you know, how people are able to access services fairly and be supported. There are there's some updated information on our website, as I mentioned earlier. There's requirements around the training that's updated on CQC website. There's some links that we're going to provide as well. And there's published guidance. So have a look at the guidance, have a look at what requirements are, and familiarise yourself, if you haven't already, with what the expectations are. I am going to hand over to Marie for the second half.
Thank you, Caroline. Thanks. So thank you for bearing with us through those slides. We felt it was really important to make sure that we sort of reiterate the points about where all of this next stuff kind of comes from, really. And many of you will have joined the webinar today because you want to understand how we plan as CQC to use the code of practice. Our main focus is, and always has been, whether services and staff are delivering safe, person-centered care and treatment that safeguards people using those services from abuse and improper treatment and meets their individual needs. We'll use the Oliver McGowan Code of Practice when we're considering whether you are meeting requirements of the regulation, and more importantly, the needs of the people who draw on your services. One of the differences about the, whilst the regulation has been in force for 3 years now, one of the differences that that the Code of Practice being commencing makes is that we're able to quote the Code of Practice in our reports. So previously, whilst it was in draft form until it commenced and became a legally recognised document, whilst we knew it was there, it wasn't something that which we could ever quote in our reports. But actually, the Code of Practice is a really, really useful document. It's a useful framework, not only for us in our regulatory role, but for you as providers of services. And that's because it lays out really, really clearly what complying with the regulation means. We all love a training matrix, you know, a list of names down one side, a list of training sessions along the top, and then a series of boxes that are either red, orange, or green with some dates in them. And that's great. But what the Code of Practice does is it lifts it from that to give it more dimensions so that we can begin to understand not only whether you are compliant in terms of whether staff have attended training or not. The code gives us the ability to understand what that means, what that training means for your staff, what that actually means, more importantly, for the people who use services. And enables us to take a much more 2, 3, 4-dimensional look at what that training is. We will, as I said, always take a risk-based approach to this, and we'll look closely at staff training and compliance with all of Regulation 18. And as Caroline said before, where your staff have been trained, we'll look at how you make sure that they're competent and have put what they're learned into practice, because that's a really clear requirement of the code. And actually, we will want to understand that where staff may not yet have received training, we will want to check what action you may have taken to mitigate the potential risks for people using services and understand your plans. We know that where staff are trained and they have the skills and the knowledge that they need to be able to meet people's needs, they're much more likely to carry out their roles effectively. So things about, thinking about consent, thinking about people, treating people with dignity and respect, being able to safeguard people from improper treatment. We know that when staff are trained, these things are enhanced in terms of the way in which services are delivered and therefore experienced by people. Thanks, Caroline. So we will take compliance into account when making an assessment of that compliance, take the code into account, sorry, when we're making an assessment about compliance. And we will also want to use the code as a prompt to understand the overall culture of an organisation. There's a big difference between an organisation that says, here's my matrix staff are trained, that's it. Or worse still, we haven't got around to it yet. It's not on our list of priorities. What you're going on about, from an organisation that says we know it's really important that we get things right for people. We know that obtaining training is quite difficult at the moment. So what we've done is A, B, and C. And I know that the people that use my services are safe because I've done this, that, and the other. You're able to explain the rationale, being able to explain the decision-making process. And actually that tells us an awful lot about the culture of an organisation. And actually being able to use the standards as they are set out in the code to help us understand what that culture may look like is a really useful resource for us, but actually for you, in order to be able to audit the decisions and to demonstrate the decisions that you've made, it should be a really useful tool for you too. We need to take the code into account when making certain decisions, and that includes right from the very off, from when services try to register with us, right from the way through their regulatory life. And we will take into account the code and how providers are meeting and complying with the requirements of the regulation. And we will do this in a way which considers the risks of inappropriate care or treatment in all of its forms, and the improper interaction with people with a learning disability and autistic people. What we know is that by following the code, you as providers will be able to show how you meet the requirement for learning disability and autism training. And actually you'll be able to demonstrate that, importantly. We're always really clear that, yes, we want to understand and we need to know information, but it's for you as providers to be assured. It's not for us to be assured. You're delivering the care to people. So it's for you to be assured and to be able to demonstrate to us how you've got to that place of assurance. That's what we want to see. That's where the evidence comes into things. Thanks, Caroline. So we've done a few things in CQC because it's important that we recognise that, we're an organisation that are kind of getting to grips with this at the same time as the rest of the world. And so we've done quite a lot of work within CQC to try and make sure that we're regulating in a way which is effective and consistent, because it's really important that we try to get this right, or that we do get it right. We do better than try, but we do get this right. So we have a programme of activities really that are underway at CQC in order to help us get to that place. We have a programme of upskilling sessions that are running throughout September. Caroline and I, when we jump off of this webinar, in half an hour afterwards, we'll jump onto an upskilling session within CQC, and they're being laid on throughout September, aimed at all staff. We've developed tools in order to support our staff to regulate in a consistent and effective way, including a brief guide, which has also been published on our website that you'll be able to see as well. Or you can see already. We have had a programme of extensive internal communications via multiple forums to try and reach as many staff as we can, because actually this is everybody's business in CQC. This isn't just about the inspectors that you might meet when they come to your services. This is about everybody who's involved in the work of CQC being really, really clear about why this is important. And as Caroline and I said when we introduced ourselves, we sit in a team of senior specialists with a particular focus on people with a learning disability and autistic people. And part of our role is to provide that expert advice and guidance and support to our operational colleagues and other colleagues when they need it. So we've really ramped up the kind of publicity around our role and how we can and should be used in order to support our colleagues when they're carrying out their roles. Thanks, Caroline. Just wanted to touch for a couple of slides on some of the questions that we're getting asked. Some of this will have been covered in the FAQ document, but I think it's worth having the discussion in case it prompts some questions that we might want to come to at the end. And that's because, they come to us regularly, so presumably they will have crossed your minds too. The first one that we get asked probably the most often is, do we consider the Oliver McGowan mandatory training as the only training that meets a mandatory training requirement? Hopefully you'll have gathered from now that that's not the case. We have recognised that it is a really good practice example. It's certainly the government's preferred package of training, and that's because, you know, when it's tested against the code of practice and you look at it against the regulations, you know, if it's procured and implemented properly, it should mean that providers are compliant with the regulation. However, that's not to say that that's the only way you can be compliant with the regulation, and I think that's a really important point to make. I suspect with the publication or the commencement of the code, it may prompt training providers to write their own training. Some of that will be good, some of it probably won't be, and actually that's where some of the standards of the code will be really helpful in terms of understanding and quality assuring the training that is procured. But the short answer to the question there is no, that we don't consider that to be the only training, but we do recognise it as a good practice example. What you won't ever see in any of our reports, or you shouldn't ever see in any of our reports, is that the name of that training package quoted. It has happened because our people have been getting to grips with it too over the last few years, and so there are a few of them peppered about. But as a result of hopefully all of the extra work we're doing now, we shouldn't now be publishing reports that describe the Oliver McGowan mandatory training. The way in which we would always describe it is the training requirement on learning disability and autism. We often get asked also about what our expectations are of the different tiers of training. The short flippant answer is that we don't have expectations around the different tiers of training. Actually, our more full answer is that we expect providers to be making that judgment themselves. So nobody knows your services better than you do. And if I take a support worker in one service and I compare it to the work of a support worker in another service, or an activities coordinator, or any other number of roles, they will likely be carrying out different functions and have different roles. So it's not for us at CQC to decide and determine what tier of training those people should be undertaking. It kind of links into the next question about what the core capabilities frameworks are and how they should be used. The core capabilities frameworks have been around for 6 years. There's one for learning disability, there's one for autism, and actually they provide quite a useful mechanism to support you to understand and to make a decision about what tier of training your staff should undertake. And actually that decision-making process is part of that discussion to have with CQC colleagues when they come to assess your service. I've made this decision and I made it based on this. This is what the core capabilities frameworks advise. This is what the code of practice suggests. So I made the decision because of that. And actually that's what we're interested in, because nobody is better placed than a provider to decide what tier of training their staff should undertake. What we will be interested in is how you're assured that that tier is correct to enable your members of staff to undertake the roles that they're employed to deliver. The core capabilities frameworks I've just described, we do get quite a number of questions about the core capabilities frameworks. There's still a lot of people that haven't heard of them. I would suggest familiarising yourselves with them because they have a really strong underpinning in the code of practice if you haven't already. Next slide, please, Caroline. Thank you. So just touching on some of the questions that we can't answer and coming back to Liz's point at the beginning, we do get asked, and I know that probably the top two questions and things that are making are creating some anxiety are around funding and availability of training. And unfortunately, we are not in a position, because it doesn't sit within our regulatory remit or indeed our legal ability really, to have a discussion about the funding required to deliver services. Those are more often commissioning conversations which need to be had in the appropriate place, be that the local ICB or the department, or conversations with Skills for Care, because our focus has to be on people who use services and how they're kept safe, how their needs are met, and how best to promote positive experiences and outcomes. As we said earlier on, the final slide of our deck does have a link to it for Skills for Care's published FAQ, which I think they published last week, which has information on it around funding and that connection there with Department of Health, and that information will hopefully be more clear as we go through the coming weeks and months, and certainly will be a topic of discussion in the webinar in November. Likewise, we of course recognise the challenges around procuring suitable training, and that is good quality and at the right level. And the provision of training is not something which can sit within our regulatory powers. for all of the reasons I've just outlined in relation to funding. On a purely practical level, there are other agencies really better placed than CQC to be having discussions around training, and it would be wrong of us to pretend any differently. Really, we can sympathise, we certainly hear your concerns, but we're not in a position to be able to have conversations or make judgments based on that. The other questions that we get asked quite often that we're not in a position to be able to answer, or the answers are quite clear but not necessarily ones that are particularly helpful, are about how strict we'll be in assessing the training after September commencement date. We've been asked that question quite a lot, and the requirement to ensure staff were trained came into force in 2022, and it built on those existing requirements covered by Regulation 18, as Caroline said earlier on. So as such, it's not really a question of how strict we'll be, because we'll always be focusing on whether regulations are met or not. And in terms of proportionality, the actions we take after that will be dependent on our assessment of whether people are receiving poor care that causes harm or creates the risk of harm. But we do not have expectations, coming to the final question here, we do not have expectations on tier 1, 2 or 3 training. It's for you as providers to decide what level of training your staff require in different roles, and to be able to justify that decision if you're asked. Next slide, please, Caroline. We do recognise that sometimes we're not always going to get it right. We aim to provide the best possible regulatory service, but we are an organisation made up of human beings. And as I said just now, we are all kind of working our way through this together. The work that we have put into making sure our communications are really clear about our approach, about our expectations, have been shared with our own staff as much as they have externally, and we've tried to share much the same information. So we're working really hard to ensure that we work consistently and regulate effectively, but it's not beyond the realms of possibility that we might not always get this right, or that there may be occasions where we get that wrong. And we should, and we will want to hear from you if that happens. Like I say, we're an organisation made up of human beings, and so human error is always possible. If you've got feedback, then please share it with us, because it helps us to do things better, and it helps us to make sure that we carry out our roles as effectively as we can do. You can provide feedback via the links that are here via our National Customer Service Centre, or if you have a complaint, then you can also do that by following the link on the slide here. To be clear, giving us feedback on our approach is different to disagreeing with an individual assessment of your service. Obviously, we've got an established factual accuracy process in order for you to submit any challenges around an individual assessment. But actually, if you have some feedback for us in terms of our approach to regulating this requirement, then please use the mechanisms here to tell us. And we'll just go on to the final slide. So here's a couple of links. So the first two are the updated areas of our website, which were updated last Monday. One is around the brief guide, which I mentioned earlier on, and the other contains much of the same information that we've covered today. And then the final one there is the most recently published Skills for Care FAQ, which hopefully will be able to provide you with some information and some direction, I suppose, in relation to questions you may have around funding and availability of such. Thank you. That's us in terms of slides. I think now's a good time to talk about some questions.
Sure.
Brilliant. Thank you. Great. Finn and Paul, have you been on it while you've been? I can see people have been posting a lot in the Q&A. So
we've got a lot of questions. I think some of those, Marie, you might find yourself kind of repeating around ability to respond to them, but I suppose there's one that's come up that's quite from Natasha Prince about how often the training needs to be refreshed as a minimum requirement, and I don't know whether the CQC has a response to that just outright. I think there was some discussion in the draft about 3 years, but
there's not actually been anything set down in terms of how often training should be refreshed. Certainly there's nothing that sits within the regulations that says that it should be refreshed at any given timescale. For us, the most important point would always be how are you, and I guess it does sort of sit within the code, is about how as leaders are you assured that the training that your staff have is still relevant and supporting them to carry out their role. And actually that's what we're going to know. We're not going to be in a position, it wouldn't be CQC's role to prescribe how often training should be refreshed. We're interested in how you're assured, as I say, that staff are able to undertake their role and have been trained in an appropriate way to do so.
Fab. Okie dokie. Paul, have you picked up another? I'm kind of taking these from most votes to least, but I don't know whether you want to go ahead and ask another question.
Yeah, there's one that's the third one down about the shortage of tier 2 training. I'm not sure that's something that you might be able to ask, but there is how this be addressed and supported in the sector.
So I think the availability of training, without wanting to be slopey-shouldered about it, we absolutely recognise that it's an issue, but those are questions to be directed really towards Skills for Care, or more pointedly probably at your ICB, because they hold the responsibility alongside providers. You know, providers don't succeed or fail in isolation. They do it because of the system that surrounds them. And if there are issues with procuring training where you are, then those are conversations to have where you are. But you could do a lot worse than picking up the conversation with Skills for Care as a starter for 10. But it's not a conversation that we're able to influence, I guess, in terms of our role.
Thank you. So there's quite a few overlapping questions, I suppose, around the period of time that this has been mandated, the length of time between the mandation and the publication of the Code of Practice,
yeah,
and your, I guess, leniency with compliance. So we've got a question here from Zinat Jagru. Given the trainings were mandated in July 2022 and the Code of Practice has only been published lately, what's the expectation of providers' compliance with training? Is there a time frame for full compliance?
Well, I guess I'd refer back to the point that we made in the slides, really, around the fact that whilst the code is a really, really useful document, it's not the regulation itself. So it's not a question of, you know, whether it's okay not to be compliant now, but by February we'd expect you to be. Actually, the question is actually, are you compliant with the regulations? If the technical answer to that is no, but you're able to demonstrate that, you know, these are the actions you've taken, this is how you're assured that people who use your services are safe, this is how you're assured that your staff are skilled and knowledgeable, that's a very different conversation from one where it may be, well, we've been waiting for the code for 3 years, so we've not actually done anything so far, so I can't actually tell you whether my service is safe or if my staff are trained. So I don't mean that to sound flippant. I guess this is about the kind of real world implications. What the code gives us is the toolkit by which to understand how what you have in place already protects people, and how you're assured that your staff are skilled and trained. It's not a question of leniency. The regulations are what the regulations are, and they're there for a reason. So actually what we really want to understand is, if your staff aren't trained, where are your assurances that people who use services are being protected by staff who are skilled and knowledgeable? Because it may well be that you're confident that they have some skills and knowledge, which might mean, you know, although you are not compliant with the regulation, you've mitigated that risk. And that's a very different conversation from a service where none of those things may be in place. But the regulation has been in place for 3 years and we've been regulating it accordingly. I would argue that probably what the code gives us is an enhanced ability to understand and assess our training, the training that you have available as a provider.
That's really helpful. Thank you, Paul.
Yeah, there's an interesting one here actually from Sarah Gribben about the it says in the CQC FAQ document, can you clarify what tier 3 training is?
So tier 3 training isn't covered by the Oliver McGowan mandatory training, and actually it exists in the core capabilities framework and is designed to meet the quite more specific training needs that will be involved in people who have some key senior, more senior roles or decision-making roles. The core capabilities frameworks lay out quite clearly what tier 3, the types of roles that might be covered by tier 3. But one of the things that although the the Code of Practice is a Department of Health document. We were involved in some of the conversations around its formation, and we had conversations about actually the omission of Tier 3 in relation to training that's available. But the argument for that, the information around Tier 3 not being as available, is because I think the view is that additional specialist input that is required for Tier 3 training will be very individualized depending on the nature of the role. But I think, the conversation was felt at the time that actually Tier 1 and Tier 2 training would be sufficient to cover most people in roles supporting people with a learning disability or autism in whichever services they provide. But generally that Tier 3 training is for those with a much more in-depth involved decision-making role for people who may come into contact with regulated services. But the clarity, to be fair, the clarity isn't there around what Tier 3 is. I think that for us, the conversation will always be, what tier of training have you chosen, and how are you assured that's right for the people that are delivering services to the people who draw on services from your service?
Okay.
Fantastic. Okay, let me see what's next, and we can try and
Can I just flag a very practical question that Ola has put in, that talks about the best way to evidence implementation of training, robust training. That includes regular assessment of competency and training matrix, reflection and CPD plans, etc. Is there a helpful framework for planning that CQC would advise providers to use to make it easy for you to see that compliance, I guess?
I think that's a really, really good question. And the short answer is no, there isn't. And that's again because we then risk going into the realms of being prescriptive. And I think if we took 10 different services, what that might look like in 10 different services would be 10 different ways of working. And the problem with creating a document that might support that would be that it would work for a proportion of services, but it wouldn't work for all. Really, it's for services to be able, providers, for all of you, to be able to use what works for you, because actually this is your assurance, not ours. You know, how you get your assurance is about what works best for you. We'll fit in with what you show us. If you have a process that means that you're able to record, you know, supervision, you know, that CPD, understanding skills, how things are put into practice. If you have a system that works for you, that's what we want to see. We don't need it on a particular format. We don't need it in a particular document. We don't need it in a particular way. Show us your assurance and help us to understand what that is, and that works for us too.
Fab. Okay, I think there's one question that's coming up, and it's asked in different forms. Again, it'll be another one of those where you've kind of said it already, but it might be worth just reiterating why and kind of how that is. So people are asking for guidance on what level of or tier their staff should be doing. So some are saying, you know, if there's one person with a mild learning disability in their setting but no one else, should they be doing tier 2? If they're just older people but domiciliary settings, should they be doing they're going to be doing tier 1 or not at all? You know, can you give people some advice on how that role to tier mapping and where they should be looking and going for advice on that?
Okay, so in terms of so I suppose the first principle that I would suggest that we need to remember is that it's not always just about the people that are using a service today, particularly within services that may have a higher turnover of people who draw on them. If we took this wider than social care and we started thinking about, you know, how this might apply to a GP practice, for example, it might be that a GP sees 4 people in one day that are autistic or have a learning disability. They might not see any on a different day. It's about being prepared for the needs of people who may come into contact with your service. That would be the first thing that I would say. The second thing that I would say is coming back to Caroline's point about, you know, this applies to people with a learning disability and autistic people. Many people who are autistic may not have a diagnosis of autism. You know, the first diagnoses of autism didn't happen till the 1940s, early 50s. There will be a lot of older people who don't even have a diagnosis of autism, but they still have the needs of an autistic person. So actually being prepared and having the skills that you need to be able to meet the needs of people who come into contact with your service is really important. And being able to undertake this training to help recognize what some of those might be is also really important. For us, it's about how you're able to demonstrate that you are in a position to, or your staff are in a position to meet the needs of people who use your services. If you make a decision about what tier of training is necessary and you are comfortable that that is in line with what the regulatory requirements are, then that's what we want you to demonstrate to us. We don't know your services as well as you do. We never can, and we wouldn't profess to. Nobody knows your services better than you. And so it would be wrong for us to make suggestions about what tiers are required in which services. So for example, if we took the domiciliary care agency as an example, you know, you could have a really large number of people who are drawing on that domiciliary care. In a care home, that might be a very small number of people who draw on the care and support that are there. But actually, in either case, we are not best placed to understand the nature of exactly which members of staff carry out which roles, and therefore we shouldn't and we wouldn't prescribe which tier of training is required. I would take you back, and apologies for repeating myself, but I would take you back to the core capabilities frameworks because they have a really strong underpinning in the code of practice, and they have, you know, there are many features of the core capabilities frameworks that have been lifted into the code of practice. So I think if you're not sure, I would suggest that you interrogate the code of practice, the capabilities frameworks. And I guess, you know, from a purely, you know, I've been a registered manager before. I mean, full disclosure, I know how tricky this stuff can be. I think if I was approaching this, I would be looking at those frameworks. I would be thinking about the roles that my staff undertake, and I would be wanting to make sure that I could just demonstrate really clearly what my decision-making process is. And I think that's the point at which you need to be able to demonstrate and be assured that your staff are trained. That's as much guidance as we can give on those tiers of training, really, because actually anything more than that would step us outside of what we're able to do in a regulatory function.
Paul, do you want to come in with a question?
Yeah, just because I asked the question about tier 3, there's another one following on from that question by Louise. And is there an expectation that at least one person in a management role needs tier 3 training at each CQC location?
No, there's no such expectation because that would be very prescriptive. So no, there isn't. That's not to say that that shouldn't be the case. If that's something that you as an organisation think is the right way to go about approaching the regulatory requirement, then that's great. That's fine. But we wouldn't prescribe that that's a requirement because actually we wouldn't hang our judgments based on very specific requirements such as that, because every organisation is so different that we couldn't possibly mandate a one-size-fits-all requirement such as that.
Okie dokie.
I'm conscious of time.
Yeah.
We probably can take a couple more, Finn.
So
I mean, there are there's some anxieties around the kind of doability of some of this. I think particularly people who've got who are running services that are focused on older people and how good the current training is. I think that's quite an interesting chunk.
Is it fair to say, Marie, that there's a fair amount that when it comes to content of training, when it comes to availability of training, when it comes to those kind of things, that CQC aren't the people that responsible for answering these questions, or kind of the people that we should be talking to about this are government, Skills for Care and the healthcare system. Is that kind of what I understand?
That is right. Yeah, you're right, Finn. And apologies, because I know that doesn't help people who want answers like here and now. What I would say though, and just as a parting kind of comment before we hand over to kind of think about wrapping up, is that this is a, quick fire webinar. It's 1 hour of one day. We can't possibly hope to cover all of the queries that people may have, and there'll be questions that you don't even know that you have yet potentially, or ones that we haven't articulated an answer to. CQC are always available to answer individual queries. You can contact us in the normal way and somebody will get back to you and have that conversation with you. The support that we're providing to our own people internally means that hopefully they're equipped to be able to do that, but if they're not, they will come to us so that we can have that conversation with you. So please don't feel like you should only ever contact us if you're in the middle of an inspection, or if there's something wrong or a notification or whatever. That of course those things mean are important as well, but we're always happy to answer questions and have these conversations. The fact that you're asking them is really positive, because actually it demonstrates that we're all trying to get to the right place for the right reasons, and it's the people that aren't on this webinar, the people that don't ask the questions, that bury their head in the sand sort of organizations that we would worry about. The fact you're here sucking up the information and have lots of questions is really, really positive, and we view that positively, as we would do you getting in touch with us and asking us questions. And they may well be questions that are specific to your services. So it may be that on a webinar with 400 and something people on, it feels like it's not the right place to ask that question. So please feel free to come to us and we'll do our very best to make sure that we give you the guidance that we can.
Thanks so much, Maria. I appreciate it. I think we've only got 5 minutes left, do we? It'd be really helpful. There's been quite a few questions asked, Liz, about sort of whether this has been recording, what people can share forward. So if someone from the CPA can kind of answer that clearly, and we can help people understand how far and wide they can share things, that'd be great. I don't know, Paul, whether you feel that there's anything else that there have been way too many, amazing amount of questions for us to cover, and I don't think we can get to all of them, but hopefully people feel like we've covered off all of the themes that we've had in the chat. If anyone feels that there's anything pressing that really wasn't acknowledged, please do let us know and shoot me an email, and I can hopefully try and follow up with Marie, and we can maybe ask any other additional things, but hopefully we've covered this off sufficiently.
So in terms of this recording, my understanding is that the recording and the slides and the more accessible version of the slides, Word version of the slides, will be hosted on the Care Provider Alliance website. The FAQ document that was sent as pre-reading is just dedicated to this webinar. So it's not for wider circulation, but CQC website will be the place to keep looking, because things are getting updated, as is the Skills for Care website. And I wonder, Marie, if perhaps we could give you perhaps you might have a look at some of the questions that have come in that we haven't been able to answer, and perhaps we could get some answers to some of those, and we could put those answers on the CPA website as well.
Yeah, I think that seems like a sensible way forward. Yeah.
Lovely. So Sam, a few minutes of reflections, wrap up. It's been a busy old webinar, this.
It has, very much so, very much so. So thank you to everyone for joining us today. We really appreciate your time, questions, attention given to the session. As Finn said, it's been great that we've got so many questions. We'd like to thank the speakers, so in particular Marie and Caroline, and then from the CPA, the colleagues Rachel and Annie, who've been in the background organising the session, and yourself, Liz, and Paul and Finn for looking after the chat. If I was to kind of summarise, I've just got 4 points that I've picked up around the session. So this is not just about the training, it's about the competencies and the effectiveness of how it works in reality in services. The Oliver McGowan mandatory training is a framework. So the code is a framework for compliance, which supports the regulation. And there's a lot that are within providers' gift to decide the how how they're going to do it. So sitting down as an organisation, writing a plan on how you're going to meet the guidelines. And just as Finn said then, there are still a couple of questions that we've not been able to answer today, but they're still there, and we will be working to try and get those answers along with CPA colleagues and CQC colleagues, particularly around accessing the training, because I know in some areas it's a real issue to try and access the training, particularly Tier 2, and to access the funding for staff to be able to attend the training as well. So I really thank everyone for the time today. I hope you've enjoyed it. There's some positive feedback already in the chat. I saw some people asking about the other session that are being held by the Department of Health and Social Care, and there's another one by Skills for Care as well. We'll make that information available so people will know the dates. I imagine the information at those sessions will be fairly similar to the information, Marie's nodding at me there, to the information that we've shared today, unless something comes out soon around, particularly around funding, but we'll be sure to let you know anyway. So thank you everybody for attending, and hope you found it useful.
Thanks, Sam. Yep, a big thank you to all the people who've given us their hour to come and listen. I hope it's been useful. Big thanks to CQC colleagues, and big thanks to my CPA colleagues who make all the magic happen. So we'll love you and leave you. Look out for the resources going onto the CPA website, and have a really great rest of the day. Thank you, everybody.